Welcome to the Results Grassroots Conference call for March 2022. For anyone who is here on their first monthly Grassroots Conference call, my name's Aaron Oxley. I'm the Executive Director here at Results, and I'd like to welcome you to the call tonight. Hope you're going to find the discussion interesting and inspiring, and we hope to explain the reasoning behind our advocacy action this month, which is to help spread the word about tuberculosis, which despite the COVID pandemic is still one of the deadliest diseases in the world and one that overwhelmingly affects people living in poverty. But first, I'm going to go through the housekeeping messages. We're going to be recording this call. In fact, we're doing it right now, and we're going to post it on the website for anyone who's missed it to watch back. So please do feel free to turn off your video if you'd rather not be in the recording. We're also going to post up any links or resources that have been shared in the chat box during the call. We use automatic captions, which you can turn on and off using the Zoom menu bar at the bottom of your screen. As per normal, please do keep yourself muted during the call. And if you've got a question or a comment, go ahead and use the chat box. We'll try and respond to you there. If you're new, please feel free to introduce yourself tonight, either by turning your microphone on and saying hello, or you can just use the chat box. We'd love to hear where you're calling in from, but it's also absolutely fine not to introduce yourself if you'd prefer not to. Anybody joining for the first time want to say hello?
My name's Noor. I've just taken on the role of group leader at Brighton. This table of lovely ladies are some new and some old volunteers, and we're really excited to be on the call and meet you all today.
Amazing, massively full room. Welcome, Brighton. Thank you, Noor. It's wonderful to see you all. Anybody else want to say hello? Okay, that's no worries. Oh, hang on, did somebody say in the chat? No, okay, good. Well, let's jump into things. So as always, I'll start with an update on what's happening in the world of international development and how it affects the work of Results. But the first thing I want to mention, which I know is on everybody's mind, is the situation in Ukraine. Results isn't a humanitarian response organization, so we aren't working directly on this, but we do have friends and colleagues there for whom we are, of course, desperately worried. For example, the TB Europe Coalition, which works to advocate for better TB treatment and patient care across the region, is based in Kiev and has a small number of staff there. As of the weekend, they were okay, but of course, they're very worried and also very angry. As a charity, we can't comment on the detailed politics of the situation right now, but it's very clear that this aggression is causing a massive amount of suffering, and the world needs to come together to address this deeply destabilizing situation. Our friends at Global Citizen have put together a list of ways that people can help, such as donating to disaster relief charities working in the region, and we're going to put a link to that in the chat box, which I hope you'll find helpful if you're looking for something that you can do right now. But no matter what happens, we know that Ukraine needs and will continue to need international humanitarian assistance, and the specific issues that we work on will also be affected. Taking tuberculosis, the subject of tonight's call, is just one example. The interruption of treatment for people that have TB and the potential exclusion of marginalized groups from TB care is a recipe for an increase in tuberculosis cases, people getting sick, and the development of drug-resistant tuberculosis. Now, beyond TB, there are many other problems which we're going to see people in Ukraine face in the coming months. Despite the many challenges faced by the international community right now, I'm really proud to work for an organization that enables people to quietly and effectively help make the world a better and safer place. Following your letter writing last month, advocating for resources for CEPI, this is the Centre for Epidemic Preparedness Innovations, the UK government just last week announced a pledge of £160 million over the next 5 years to help fund CEPI's work to find solutions for new and existing disease threats, including CEPI's plan to cut down the time needed to develop new vaccines against new diseases to just 100 days. A huge thank you to everyone who took part in the campaign. You've materially helped to get this pledge to happen. However, £160 million over 5 years isn't nearly as much as we were asking for. And we believe, if you remember, the UK's share of support for CEPI needs to be more like £300 million over that 5 years. The level that they've given it is actually a slight drop from the level of funding the UK was previously providing to CEPI. Now, we've had a big cut to the aid budget between now and then, but even so, they need to do better. As the host of an international funding conference happening in just 6 or 7 days' time on the 7th and 8th of March, the UK must increase its contribution then. And we're hopeful that they might do this to help other donors to follow suit. So watch this space, look for news on the 7th and actually particularly the 8th of March. And meanwhile, we'll put a link to our statement on this latest development into the chat box. Next, another thank you to all of you who took our January campaign action on the fight to end polio, a crippling disease of childhood that has almost but not quite been wiped out. The responses have been trickling in from government, and sadly, from the letters you've been sharing, they don't sound like they're ready to reinstate their funding for this anytime soon. But that doesn't mean we're going to stop pressuring them, and we need to be in this for the long game. If anyone needs convincing of the risk of going backwards if this disease isn't contained, last month's news from Malawi came as a sobering reminder. A little girl who'd been brought there from Pakistan has contracted the disease, for which there is no cure and will now be paralyzed for life. As the virus was imported from abroad, the single case doesn't affect the African continent's polio-free certification, but there is a big risk that the virus could now be circulating in the environment, and health officials are taking urgent action to ensure this doesn't become a widespread outbreak and start affecting children in local communities in East Africa. Again, we're going to put a link to some of the information around this into the chat box. Next, I want to move on to the advocacy we'll be asking you to undertake over the next couple of months in the fight against TB. Those of you who've been campaigning with us for a while, and particularly many years, you'll know about the excellent work of the Global Fund to fight AIDS, TB, and malaria, though we haven't needed to do any public advocacy around that for a couple of years now. That's going to change next month when we'll be asking you to ask the government to contribute to the Global Fund's 7th replenishment conference. That's going to be happening in September of this year, we think, in the USA. The exact date to be confirmed. It might be a little bit earlier or a little bit later. The Global Fund's investment case asks for $18 billion for the next 3 years, that's 2023 to 2025 inclusive. And this was launched just a few days ago by the presidents of the Democratic Republic of Congo, Kenya, Rwanda, Senegal, and South Africa. These African leaders came together and called on the world to join them in their determination to reach the ambitious goal of ending HIV, TB, and malaria by 2030, and build strong national health systems to respond to emerging pandemics. We at Results are proud to be working in partnership with civil society organizations around the world, such as our Action Global Health Advocacy Partnership. Now, I was quoted in The Guardian last Wednesday as saying that with deaths from TB increasing to 1.5 million people in 2020, these global efforts are needed now more than ever. Again, we're going to link to that article in the chat box. By the time we reach next month's conference call, UK civil society organizations, including us, will have worked out exactly how much we think the UK should be contributing to this total of $18 billion. So watch out for the details on that in our materials next month. This month, we're going to be laying the groundwork for that action and for World TB Day, which is coming on the 24th of March. Last of all, I have some personal news, which is that after over a decade as executive director, I'm going to be leaving Results in the autumn later this year. This isn't a decision I'm taking lightly, as I truly believe I have right now absolutely the best job in international development in the whole of the UK. But it's time to let someone else lead, and as my family's relocating to Sweden later this year. I'm sharing this news with our Grassroots network, all of you, before we make this public, because one thing I'm immensely proud of is that in the many years I've been associated with Results, I've been able to stand together with all of you. It's been a wonderful privilege to be part of this movement with you, wonderful people from all around the UK, and of course with our international partners as well. There's been no better goal to share with you all that of ending poverty everywhere, and to collectively put our power to use to get that job done. We've done a lot together. And while we're going to be talking about this a lot more over the next few months, I really do want to thank you all for being totally amazing. And before anybody starts in with a eulogy for all of my time here, let me just say there's still plenty left to do in 2022, some of which we're going to be talking about tonight, and I'm not going just yet. So keep an eye out for the public announcement of this change, which will be coming in a couple of weeks when we officially launch a process to find the next amazing chief executive for Results. Until then, do keep this news in the Results family. And with that extremely difficult announcement out of the way, before we hear about the subject of this month's advocacy, it's time for my favorite part of the call, which is to hear about all the advocacy you've all been doing around the UK over the last month. So I'm going to hand over to Tanya for the usual Grassroots update. Tanya.
Thanks, Aaron, and hi, everyone. It looks like there's a lot of new things for us to cover in this call. So firstly, thank you to everyone who has taken that action, calling on UK support for CEPI last month. I also want to highlight Jill's blog that she wrote for the Catholic News on vaccine inequity, which is insightful and very well written. I would recommend having a look. The link will be put in the chat box. So some updates. We have 2 new group leaders joining us. So there's Noah in Brighton and Ross in Edinburgh, and I just want to say a quick welcome. Thank you for following up with replies on some of the other campaign actions. We've seen a few replies being sent back on actions from months ago, such as the replies on the Nutrition for Growth Summit. So well done on your determination and perseverance with this. We have seen the replies coming back from January's polio action. Unfortunately, they're not very supportive, but Karen's polio letter, which was such a personal and emotive one, well, we shared it with our policy officer on child health, Chavi, and she shared it with Sona Barry, the external relations coordinator for polio eradication at the World Health Organization, who was our speaker on our January conference call, and she shared it with her colleagues. So it was eventually tweeted by the WHO polio director. So that's a massive achievement. We had a End the Pandemic Lobby Day in Parliament on the 23rd of February. And you may have seen lots of tweets about the event. And I just want to say a massive thank you to those who came. And I was hoping that Yao could say a few words on his experience, as this was his first lobby day.
Thank you, Tanya. So I'd like to give a very short report on the experience of the Swansea team. We came to London with a train. We got and then took a bus towards the Parliament area. Actually, that was my first time of coming to London, as in the city itself. So myself and my friends, we were 3 in number, from 2 from Swansea, and we met another member in London. But we got lost. So we got lost in that side of how should I put it? We were very close to the Parliament House, but we got lost. We were just asking people. Someone would say, okay, go towards this place. We go there, they will give you another direction. So we missed the photo shoot at the Victoria Tower Gardens. By the time we go to the Parliament, they were already in the Churchill room. The program had already started. And but it was a very good program, like very fun. All the other NGOs, One, VSO, Aid Alliance, everybody. It was very fun, like very interactive. Yeah, very interactive. And then later, the Q&A with the 2 MPs, Prit Gill and Anthony Magna, was very fantastic because they answered the questions very well, gave a lot of information about what they've been doing concerning vaccine equity all over the world. It was very informative. And then I had a chance to meet, I think, most of the London members of Results. I met almost everyone. And then I've forgotten. Yeah, mostly London members. And we had a lot of discussions about Results. And then I also met about, I think, 2 MPs, James Murray, and I've forgotten the other one's name. Sharma, or I've forgotten his name. And then we had discussions about vaccine, what they've been doing on the floor of Parliament concerning vaccine equity. And specifically, I also asked James Murray about one of the actions that we took concerning the reduction of the aid from Not 7 to Not 5. What he did, and he told me that they raised it. He himself was against it. They raised it on the floor of Parliament, and then they're expecting the PM or the government to take action on it. So I think that action that we took, it had a lot of impact because he said they raised it on the floor of parliament and they debated it. So I think on the whole, I would say it was a very nice experience and we really enjoyed ourselves.
That's good to hear. Thank you, Yao. I just also wanted to give you a save the date for our national conference, which will be held on the first weekend of July. So that's the 2nd and the 3rd. And lastly, I'd like to announce the new design of our materials, some of which you might have already seen. So this month there have been new campaign guides to go along with our TB action. And next month you will see a new actions sheet. So it would be great if we can get any feedback on these. And that's all from me. Back to you, Aaron.
Sorry, Taya, can I add this?
Yeah.
So our MP, Jerry Davis, he was not able to make it. But we had all these booklets for the MPs. So I took my copy, which I'll add some, and there are a lot of messages in it. We also add our message to it and then send it to his office so that he'll be made aware of the campaign that we are having. Okay, thank you.
Thank you, Yao. So I think it's back to Aaron now.
Thanks so much. You know, there's absolutely nothing like FaceTime with parliamentarians, and when you can't get it, being able to follow up in writing is super important. So, yeah, thank you so much for that. You know, these are the things, particularly when we haven't been able to meet face to face for so long. These are the things that can really move people to understand our issues and to take action on them. So, thank you so much for doing that. And Tanya, thanks for all the update from around the network. It now falls to me to introduce the topic of this evening's conversation, which is to hear more about tuberculosis and why it's such a big risk to health around the world, and also to think about what our role is in gaining the political will needed to end the TB epidemic by 2030. That's now just 8 years away. So we're going to be hearing a lot more about that from our guest speaker, who's Dr. Uvistra Naidu, a pediatrician in Cape Town, in South Africa, with a special interest in childhood TB. Dr. Naidu, I think I see you there. Do you want to say hi?
Hi, everybody. Hi, Aaron. Thanks for introducing me.
So big welcome to you, Dr. Naidu, and a huge thank you for making time to be with us this evening. I know it's a little bit later in the evening and where you are than in the UK, so thanks so much for staying up. Let me start by letting you know who we've got on this call. I mean, you've been with us for a little while, so you've heard a little bit of it. But you're joining our grassroots volunteer campaigners from right around the UK, as I like to say, from Scotland to the South Coast. These are people who regularly take advocacy actions, mostly aimed at the UK government, to try to persuade them to prioritise international development programs that tackle poverty and injustice. We've got people on this call who've been working on these issues for many, many years, but we also have some people joining us tonight who are very new to international development and global health. And there'll be quite a few people who are brand new to the issue of TB as well. So as we do every month, we've got 3 pre-prepared questions for you to get the ball rolling. But before we ask those, I'm going to ask you if you could explain briefly what motivated you to become a medical doctor and a bit about your interest in childhood TB in particular.
Thanks so much for having me, and please call me UV. I'm super sad to hear that you're leaving as well. Always look forward to your writings in public media space as well. So basically, I'm UV Naidu. I'm just the provision. You can look at me now. I'm recovering from severe COVID-19 that I picked up twice, being an ICU pediatrician. So I'm now battling long COVID. So I have some lung, heart, and some adrenal gland damage, and a lot of it was largely due to my TB experience I had personally as a patient suffering MDR TB between the years 2008 to 2011. So it took me about 3 years, 1 week, and 1 day to be completely cured. I had many side effects, a lot of them life-threatening, and a lot of ICU time during those 3 years, and some good doctors, many unanswered questions, and I really got to reflect on what the patient went through. So after completing TB treatment, which I acquired as an intern, junior doctor post medical school in South Africa, I decided to learn more about the TB science world. So I spent some time in the US and with some European colleagues to learn laboratory TB work. And my ultimate aim was to try to bridge the gap between laboratory brilliant minds and the clinical guys that actually touch the patient's hand. And I've always been trying to advocate largely to speak the patient's voice, but largely just to provide some empathy into the science, which I do feel is very lacking in the world still. That's me.
Thanks, Uvi. Extra bonus thanks for joining us from your recovery. Really wishing all the best for that. But yeah, even more grateful that you're taking the time tonight, and thank you for sharing your personal story. I mean, it's amazing to hear how your experiences have shaped your interest, and now you're doing such amazing work to fight the disease. So thank you so much for sharing that. Let's jump straight to the first of our pre-arranged questions before we open up the floor to everybody to ask questions. While we do that, if things come to you that you want to ask about, feel free to put them in the chat. For those of you that can't reach the keyboard, I noticed that Brighton, for example, there's a whole pile of people that probably can't reach the keyboard tonight. Do feel free to text in your questions. The number for that is 0777 56 11178. That's 0777 56 11178. We'll put that in the chat too. But let's go to the first question this evening, which actually is from Brighton. Brighton, do you want to take it away?
Can you hear me? Am I too far?
Yeah, I can hear you. Nice to meet you guys.
Nice to meet you. Why is TB still such a big problem around the world?
Yeah, it's so multi-pronged and multifaceted. The first day I walked into a TB research institute, that was the statement given to me, and that was 10 years ago. And I still think that hasn't moved much for myself. So I think there's little global synergism and cohesion. Very few public-private partnerships that are engaged in terms of uplifting, getting agendas ahead from the scientific, clinical, R&D funding world. And I think also there's a lot of, due to COVID and political leadership, there's gaining public mistrust against science. And with that, the TB message does really get lost, especially the last 24 months with COVID-19. There's very little political will. If you look at our United Nations high-level meeting, which we had in 2018 in New York, a lot of money was pledged, a lot of promises were made, and it was so energized. But you know, COVID-19 was an opportunistic reason to not come through on their targets. We need more R&D and funding. We clearly have never actually hit the benchmark of what was needed. And the reality is, I think when the Western or rich developed world is in fear, a lot of funding comes through. And I think when a lot of poor voices are not heard and we don't give them a face or a platform, it's very easy to sweep them under the carpet. And I think TB is such an easy disease to fall prey to, fall victim to that happening. And I think there's just, when I look at the TB academic community, being myself a pediatrician and a scientist, and I'm actually not well liked in academic circles by at least 50% of the old generation guard that's been there. And I think I've always been trying to add that I want to always provide empathy and give a voice for those that suffer. The science should translate from the patient. And I think there's a lack of activism on behalf of the patient and people in communities. I don't think we see enough of those faces. So those are all the things that just accumulate, and we just don't move ahead. And I think COVID-19 is, as we got a little bit of momentum, we actually have gone behind, because all 5 or 6 of those problems are all working together against helping us eradicate TB completely from this planet.
Thanks, Uvi.
Cool.
That's we are facing quite a steep set of challenges for sure. Let's jump over to our second question, which is going to come from the Edinburgh group.
Hi. it's very interesting, and it's so good to hear someone who really gets it at the level of the patient, and in a country where patients don't get listened to very much. So it's really great to hear. And the question I'm going to ask you, I think I might have one answer, but because of the interesting way you've introduced yourself, I think that it'll be really interesting to see how you answer it. The question is, why is the fight to end TB so important in 2022?
Well, we've had dreams. We had these big meetings with politicians and role players, and we said 2022 was going to be one of those target marks where we'd have so many people treated and so many people diagnosed with TB and on preventative treatment to actually end TB by 2030. We've just faced too many setbacks. If I had to eliminate COVID-19 completely from the conversation, I still think we would have faced that. If I look at where we are in terms of TB diagnostics, so when I was diagnosed with TB in 2008, I never had DNA technologies. We have a platform called the GeneXpert that wasn't available. And right now, even though we've got this fancy type of technology with culture mediums, which is the gold standard, there's still such a gap between the true patients and what we are globally estimating by models by the WHO each year. I think the WHO needs to come more into the party, and they've been very active, but I do think a lot of politics has come into play. If I look at in the country I grew up in, South Africa, we've had active case findings up until 1974 endorsed by the WHO. The WHO has cancelled that. And if we look at COVID-19, if I bring that back into the conversation, active case findings is actually what's so synergistic in the whole global conversation right now. And it's such an opportune time for us to consider we could actually bolster COVID-19 with a TB response at the same time and get very close to what we aim for this year, end of 2022. The Global Fund has been such a great introduction to the TB world since it became a global health disaster. And we just really have to look at how we can gain public interest as well as private interest to help replenish funds to continue the fight forward. We can't move forward without innovation. I'm so flabbergasted at how quickly it was to get WHO approval for COVID-19 tools and treatments. And when I look at the rigmarole to actually get a TB diagnostic tool on the market, as a scientist and a clinician, it's worrying, how we find reasons to block certain things that just accelerate others. And I think why it's so important that we need to get on the ball quickly is none of us know our future is tomorrow. I personally just think tomorrow may be my last day seeing a patient, given this pandemic and wars that are breaking out in this world. So I think it's a time for hope, and the only way we can do that is to say that we don't know quite where tomorrow is going to lead, but we should try reaching what we initially set out as our targets and dreams. I hope that answers.
It does, Uwe. Can you mentioned active case finding in your answer. Could you maybe talk just a little bit about that and expand on why you mentioned that, just so people know what that is? Because
sure.
I know, and I think everybody does know, but they don't know it with that name. So maybe just
my apologies. Sorry. So what we rely on as doctors and nurses and health systems is passive case finding. So basically, we only actually investigate a patient for tuberculosis when they come in with symptoms of TB, a cough or loss of weight or body weight. But traditionally, when TB was quite rampant throughout Europe and the developing world, we had a vaccine and we had a few drugs, but we had very little knowledge of whether we were going to curb it. Up until 1974, we used to actually go into populations and just do random testing of people actively. And we tried to see what was the turnout rate for TB disease spreading in a community. The WHO thought the yield was very low in this strategy in 1974, and actually have not revisited that. And I think last year at the Union, conference for TB, there was a Cape Town group that found that I've been trained in medical school that when you cough, you spread TB bug. And they had actually discovered that it's likely also when people are breathing generously, there's enough bacilli spreading into the air. And because we know TB spread largely by the air to the lungs, it's actually giving us a little food for thought that we need to get back into that active case finding of just going into communities and testing patients. And I think we're doing it with COVID, so why not just double whammy it to get TB tested as well.
Thanks, Evie. Really helpful. And you've started to answer some of the questions coming through the chat for that as well. Excellent. Okay. Let's jump over to our third question, which is going to be coming from the Oxford group.
Hello, can you hear me?
Yeah, nice to meet you.
Nice to meet you too. So our question is, how can we help to get the political awareness that's needed to end TB?
Yeah, that's a good question. We can't get anywhere without political leadership. I'm not too sure these days if we actually have great leadership on a world scale, if we could all put them in one statement together. But without them, we really can't get the message across. We can't get funding. We can't get policies adopted. We just can't also get the public to grab hold of what the message is. I think the biggest problem I find with you guys in the UK, myself in South Africa, I really feel politicians don't see the faces of people that suffer, honestly. I look at my fellow medical colleagues. I was a doctor admitted into an isolation ICU with COVID-19, and 4 patients died around me, and one of them was a medical colleague. And I've never seen that pain translated from a politician's speech at all. And like I said, COVID-19 spoke to the wealthy and the poor, but TB has been devastating families for decades and centuries. And a modern day politician talks and aims for power, but I really don't think they see the faces at all that suffer. And I hope through advocacy and lovely organizations like you and people at a grassroots level, each face, each story told with the placard, it makes a difference. I don't know anybody who doesn't feel bad for hearing a story of a child that has cancer. Or even in the AIDS community, where they're so synergized and active about people that suffer with HIV and AIDS. We just seem to don't do this with TB that well. We call out a lot of numbers and statistics each year, how many people are infected and how many people die. But I actually would like to know, I mean, you're in certain area that you're from, what was the person's name, where their family, how many people are being looked after by this politician. And I think if TB communities and research communities actually lead the narrative from the sufferer and get the science and clinical work around that in the messaging, politicians have to hear it. And that's when I think they'll start caring a bit more, adding these into their speeches and what their desired targets are for the prospective years.
Thanks, Uwe. Yeah, we know that it's very, very difficult for decision makers to be able to ignore the face of somebody right in front of them, and to when faced with people's common humanity, that is far more powerful than some of the numbers that we are able to bring to bear on the problem. Why don't we jump into some of the questions in the chat, maybe a South Africa specific question to begin with around the TB and the gold mines there. I'm not sure how much of your background is specifically on that, but Peter and Deirdre's question stems from many years ago in Results UK, where we were working with Jonathan Smith, who made the film. I'm sure you remember that, about how many of the migrant workers in South Africa's gold mines would contract both HIV and tuberculosis because they were a long way away from home, working in very, very difficult conditions, overcrowded accommodation, dormitory accommodation, deep in the mines, lung damage from the dust and the rock, which made it very easy for them to get TB. And there were a very large number of TB cases that were spreading amongst that quite vulnerable population in the mines, and they were in really quite a bad way. The Results campaigned on that back in the day. And we actually, and I should say this, as you now all know that I'm leaving, I'm going to tell you this story. One of my personal proudest moments was when I walked out of a meeting in the World Bank in Washington, DC, with a piece of paper in my hand. And I was able to say, this is a $60 million piece of paper, because the World Bank is going to do a $60 million program in gold mining in South Africa to work with the companies there to help address occupational TB amongst those communities. Now, of course, it was all super secret and we couldn't tell you all about it at the time, but that was great. I've still got that piece of paper. So, and that, I think we can trace that back to some of the advocacy that some of the people on this call did. Uwe, that was many years ago. Do you have some kind of an update for us on how the situation has played out since that issue got more attention than it had previously?
Yeah, I think more rights in our new government that moved over from 1994. So I actually specialize mostly with childhood TB and immunology, so I'm not very well read on occupational diseases. So please forgive me if I'm misquoting anybody. Dr. Gavin Churchyard is a distinct expert in this field. But from what I understand is it is far improved, but I think it's still rife. It's not that it's eradicated within the mining sector. See, a lot of these workers come from rural areas, and a lot of their families get transmitted closer towards the workers and create peri-urban settlements. And that lies this problem in South Africa, where we have such a divide and inequality and between the rich and the poor. So these peri-urban settlements are faced with poverty, malnutrition, and HIV. And it actually, we're not too sure where these laborers actually are going to a informal settlement to meet their families, or they're going back to the traditional home farm area, rural areas, as they did in the past. So I think at the moment, it's actually a mixture of informal settlements where a lot of these workers are settling down and then going back towards the mines, where it becomes a problem. I think the mines are far more regulated than they were about 20 to 30 years ago, and technology is far available, and a lot of good policies have been implemented. And Dr. Churchyard has been very key to this being happening for the last few decades as well.
He's a real rock star. Yeah. I think it's good to hear that progress has been made with the mining companies. I think they were always. I think the biggest challenge, and I mean, speaking specifically to Deirdre's question, I think there's been really great work done by people like Dr. Churchyard, by the government of South Africa, and indeed by the mining companies themselves with their workers. Particularly for the larger companies, it's this medium and the small companies that are, or the unregulated companies, well, not even companies, the unregulated mines, where this continues to be a particularly persistent problem. And because these are often operations that are flying a bit more under the radar and aren't as connected into regulation or health systems as some of the bigger organizations. So glad to hear that we're making progress. But yeah, there is always more to do. Let's go to Jill's question before I go back to Deirdre and Peter's other questions that they've put in there around COVID. Jill, do you want to read your question out or say it so that it's not me doing all the talking tonight?
Yeah, okay. Results also some years back did some work on TB in the UK, because the UK didn't have a TB policy, an overarching policy. And we did a lot of work on this, and they produced a policy to the point where in 2019, the rates of TB were at their lowest since 1960, I think it was. And I count that as a success story. And it's always good to have success stories when you're writing articles or blogs, things like that, to show that it can be done. Is there anything, any other sort of success stories that we could use, or could we use the UK one? Just some advice.
Should I take it? Well, of course. The great thing is we learn from each other, and it's this when I first started TB research, the word collaboration wasn't very appropriately used and used as regularly as it is now. I think if you look at the data, the largest areas hit with TB morbidity and mortality are sub-Saharan Africa and Southeast Asia. And I think when we look at models that work in places like in the UK and try to adapt it into those areas, it's like important to actually show how we're so connected with diseases such as this. But yeah, I really think talking about success stories are really important. I think it's also not nice if we're speaking up to politicians and just keep giving the humdrum, we're failing, we're failing, we're failing. But it's nice to give success stories. On a personal level, Jill, I also like to call myself a success story as well on the TB front. And had I not had the family support and the care that I had as a medical doctor, I wouldn't be here today. I do feel a bit saddened that a lot of my patients don't have the privileges that I do in South Africa. And, you know, it's a difficult one for me, but I always like to call on hope in any of the talks I give or the messages I give by publication. So success is it's a positive spin on what we are doing. We are doing good, but I think the message behind that is we want to do more as well.
If I could say one thing, particularly about South Africa, I mean, I've been involved in TB long enough to watch South Africa go from a country where TB was very much in the backseat compared to some other public health interventions. And then under Health Minister Aaron Motsoaledi, great guy, excellent name. He really got a lot of money from the government to go into this, made it a big political priority, empowered the permanent secretary to make big investments from the health service. You know, South Africa has been facing a devastating tuberculosis epidemic, but it certainly from where I've been standing, the response of the South African government has been truly extraordinary. More, of course, can be done. Everything is not perfect, you know, but the default option of doing very little was not the one that was taken. And I think so. I'd love to hear your take on that. And I think that's especially important because quite often in the world of international development, it can feel like it's just ask the donors, ask the donors, ask the donors. We're going to be doing a lot of asking the UK government for money for international development issues this year, a lot of money for health, for COVID, for CEPI. We just talked about that, for the Global Fund, for vaccines, all sorts of stuff. But I think it's really important that we can acknowledge that countries like South Africa increasingly taking ownership and increasingly putting in large amounts of resources and political energy as well. So I'd love your take on that.
Yeah, no, I really agree. Minister Motsoaledi has been, I think before him, we actually never had a voice on the global stage besides doing a few good publications each year, I think from an academic front point. And where there's political will, I think things do change. I have to be on the other side of it, where I also am, but I'm a local citizen, so I think I'm also a little bit more critical of my own government. We like to project a positive image of ourselves abroad, but I'm quite unhappy here. I always want more. I want more for my medical doctors and more for my nurses. I've lost 25 colleagues, including my father, who was a professor of medicine last year, to COVID-19, and where they could have just stepped up at the right moments, we chose to focus on other political priorities. And I think each government has these issues. South Africa is none the better. But I am coming from a viewpoint which has changed in the last decade. I've been speaking on behalf of the patient. And I think the last 2 years, I find myself speaking more on behalf of the healthcare worker who's on the front line and risking a lot. And I think little's been done to realize that doctors and nurses and hospital cleaners are at risk, not just of COVID-19, but the unknowns of TB disease in this new world we're facing ahead. So I want my government to be more proactive on that conversation, which I feel that they are not listening yet.
Thanks, Evie. Dose of reality. Thank you.
Yeah.
Voice from the front line. Let's jump. We're going to actually open the lines for anybody that wants to unmute, say their name, and ask a question before we circle back around to the questions in the chat to wrap us up. So, William, I noticed you immediately jumped off mute, so I'm actually going to go straight to you. William, do you want to ask a question?
Well, perhaps there are two questions, and they pick up the point of the Ukraine situation. A number of years back, we were led to believe that Eastern Europe was the hotbed of multi-drug resistant strains of TB. And I'm just wondering if the refugee present us with a problem today. That was maybe one question. And we also hear about seizing Russian assets. I'm not sure as to, do we just hand them back at the end of the problem, or can we confiscate them and put them towards health, world health?
Aaron, do you want to go?
I think that last one's above the pay grade of almost everybody on this call, William. I mean, it's a fascinating idea, and if I get 5 minutes with our Prime Minister, I'll definitely say something about it to him. But other than that, I don't think I can speculate on that last one. Yui, do you want to tackle the question of multi-drug resistant TB and potentially stigma and some things that might be attached to that and what that might mean for refugees?
Yeah, I think that's a very worthy question. I think I myself, being diagnosed with multi-drug resistant TB, so I was a misdiagnosis by multiple professors, and it was actually my late father who had made the diagnosis. And the stigma I had actually faced from family members, colleagues, friends with children, and not wanting to be around me for a period of 2 years was really tough. But I think the incoming migrant populations are importing a lot of disease, but I think what is really great in the Western side of the Western world is there are systems in place and a good surveying and screening of patients that come through. So there's a lot of active detection of possible problems. And I sit in a lot of European pediatric TB chat groups, and these are detected very quickly within these migrant populations. Coming in a country like mine, where there's so many question marks for the undetected, because we just don't have enough resources to be diagnosing the problem of TB. That being said, we don't know what we're doing in terms of detection. We don't have adequate diagnostic tools. We miss a lot of patients that we test. Once we diagnose a patient, we don't know if we're undertreating or overtreating a patient. We also don't know what are good biomarkers to detect as an endpoint. So biomarkers are basically a type of test, could be blood or sputum, that if you are diagnosed with drug-resistant TB, for instance, we would monitor the progress of those markers from start to finish. And these helps treatment trials and vaccine trials to help give us as doctors sufficient endpoint. So I think look at this war in Ukraine. What is going to happen to COVID there right now? What is going to happen to drug-resistant TB? I've got 2 pediatric TB doctors that are specialist pediatricians in Odessa and Kiev right now that are locked in a bomb shelter administering TB treatment to kids themselves there. I don't know who is going to absorb these patients if it gets worse, but I'd like to hope that with the system, what we do have in terms of technologies and resources, the West would be able to cope. I think if they all came to South Africa, we'd battle, and it may be a major problem there if that was the situation.
Thank you very much.
You're welcome.
So let's go to a couple of questions that from earlier on in the chat. coming back to the relationship between TB and COVID, a couple different things. One, how what opportunities do you see to beat these diseases together? We talked a little bit about active case finding. Maybe there's some other ways. Well, I can think of a few. You can probably think of many more. But then also, is there a reason why, other than will and money, that the development of drugs and vaccines for TB is so slow?
So on that last bit, I mentioned it in just before. So the WHO has put up, the TB team within the WHO have put up many rules and regulations in terms of how we can get a national or WHO endorsed diagnostic product. And to go through that screening process is quite arduous. And the reason why they did that is that many companies were releasing certain types of, we call them serological assays. So they were like antibody tests, what you understand from COVID antibody tests. And they just weren't performing well, but were on the market to be purchased. I think we can't be having this rigidity anymore. I think life has changed for you and I. These lockdowns, mask wearing, there's just chaos been thrown to all of us, and we're all battling to manage. And I think systems with strict rules such as that need to come back and adapt. And we need to pull back what we were doing from 60 years ago when TB was rampant and try to scale up accordingly to what's needed today. And I think looking at our experiences and how we worried in the past, I actually think that can be used to advantage today. I really feel there's so many things that are overlapping with COVID and TB in that they are both airborne diseases. And they are both very largely unknown diseases in terms of what the virus or the bacteria of TB does, because they both evade we aren't managing them well. From the COVID point of view, we are just supportively treating our patients. With TB, like I mentioned earlier to, I think it was William's comments about Ukraine, where we don't know which markers are adequate and which drugs are adequate to treat a patient at this moment. So it's a lot of thumb sucking. And I think if we go back to grassrooting thinking, like what we did from the 1950s onwards, we'd be able to handle these both situations quite well instead of just being very siloed. And I feel if it just takes one common sense thinker to achieve this. And if it's spoken on a funding level, you'll be able to get that political will at the same time. But common sense is not very common these days. So I think we're all just trying to recover from COVID, and there's been so many other things in the news that have been plaguing. And I think we are forgetting how control was achieved so well from 1950 to 1980. And we could do that again quite easily. I hope I went off at a tangent. I'm sorry. I hope I answered that well.
It was, I didn't notice if it was a tangent. It was a very interesting one. Okay. We've only got 5 minutes, so I'm going to try and cluster a few things together to round us off.
Aaron, sorry to interrupt you, Aaron. Sorry about that. Could I ask one very quick question?
Go ahead, Bentley.
Hi there. The WHO made an announcement, I think about a week ago, saying about they're going to open up maybe about 3 or 4 labs in African countries all around Africa. How important do you think that this decision, do you think it's groundbreaking? Do you think it will make any difference to, I think this was about COVID, but will it make any difference to COVID and any other diseases which grips Africa at the moment? Thank you.
Sure, that's a great question. Well, so I think on the COVID front, from what I understand, it's also just scaling up production within Africa. And it's allowing these products not to be proprietary products like vaccines, for example, and to help prevent inequity of services and vaccines and treatment. So by making these manufacturing plants, it actually helps grow home talent from a R&D academic point of view, develop systems, jobs, all of those things. And I mean, that has such a ripple effect on a disease of poverty on many fronts, from TB, malaria, HIV as well. But yeah, I think more action needs to be taken in this way. As things are made and developed, I don't see why it needs to be made in the West and translated in poorer settings later. I think there is good enough work being done in Africa academically. I think there's bright enough minds throughout this continent, and with company agencies such as you guys and institutions from the research front in Europe, we have more than enough support. And I think Africa is pretty much respected in terms of the academic input they provide. It's just in terms of getting the public awareness and the political awareness to see that we're quite a global functioning of health. And I think maybe that's the next WHO agenda, to actually show that certain things will be done in Africa, certain things will be done in Europe, certain things will be done in the Americas. And if we talk that language, then the world knows where things are coming from and how we need each other. I hope that's the political directive of why they're trying to do this as well.
Thank you.
Thanks so much. So now with only 2 minutes left, trying to wrap up a bunch of stuff in the chat. No, don't apologize at all. This is why we're here. Really, for those that have been following the chat, there's been some very interesting sidebar. Ricky asked the question, right, I think it was Ricky, it could have been Karen, or both of them together maybe. Hearing from the patients, how do we get individuals' TB stories into our campaigning? And I think a really important follow-up question, how do we share those stories sensitively and avoid sharing poverty porn or degrading or demeaning or disrespectful stories, or doing that in a way which is not really true to how that story should be shared? I mean, for results, I can say that we are not going to share any information with you, for example, like the Speakers Bureau or some of the other links that we put in the chat, that are things that you need to be concerned about sharing. I mean, we're not going to be passing any of those kind of imagery or any of that kind of messaging on to you to share. These are powerful, smart people that are sharing their stories openly, in full knowledge of what they're about and how it's going to be used very powerfully to help drive change. So we're not going to put you in contact with rubbish resources. But I think, Yuvi, do you want to talk a little bit about your answer to that question? Because I think your perspective will be incredibly.
Yeah. I have never met a TB patient in a clinic in South Africa. So I went to the US to specialize in how to diagnose TB in the stool of babies. So I was looking at cheap point of diagnostic tests where mother brings a nappy to the clinic and we screen that because the baby coughs, swallows the sputum, and it passes through the digestive tract, and we could diagnose TB. And every single informal settlement that I walked into to get this, I have never met a patient in a drug-resistant clinic or myself. I sat in public drug-resistant clinic myself as a patient with other fellow patients, and all of them were very happy to save another life if it meant that they could share their story. And I think you'll be surprised if you meet somebody on a human level, they'll be willing to share that with you. Claire and I and lots of other colleagues at ARV, and we had this consortium called the TB Vax Arm. And I reached out to colleagues throughout Europe and in America to say, do you have any TB patients that will be willing to give their name and their story if there was a poor outcome or good outcome? And they were so generous in doing this. And I think we've come in at a stage where we want to know about human stories. And a lot of us are suffering in our own way. And I think all of those stories deserve to be told. And I think the TB community, speaking for the poor man, I think it's now better than ever in my life, actually, that it's an easy story to tell. And I don't think we need to be extremely woke about this. People care about other people suffering, despite what we think about the world as a whole.
Wow, what a wonderful way to finish. And I think that's why we're all here on this call, right? We want to end that suffering and do the things that we can do from where we are with what we have. That's why I love working with this group of people. Thank you so much. Thank you so much, Yuvi, for answering all these questions. You know, we have run out of time this evening. I just really want to thank you so very, very much for sharing your expertise and your personal story, the challenges that you face, the work that you do with us this evening. Really inspiring. Please keep up the good work and please look after yourself. Get well soon. Really incredibly, incredibly important. I really want to thank everybody who's on this call. You're really smart, engaged, intelligent questions. I think most of our guests usually text me afterwards and say, oh my God, those were great questions. You've outdone yourself again tonight. So thank you everybody for that. I hope everybody feels inspired to share your passion for taking action to overcome serious infectious diseases such as TB with others in your community or in your online networks, and really use this coming World TB Day, the 24th of March, as an opportunity to show why this year is an important one, especially with the Global Fund replenishment coming up again. We're going to be talking about a lot more about that next month. So I'm afraid we're totally out of time, but please do keep sharing your successes and sharing your stories with each other. If you've got any concerns about how to communicate personal stories, do follow up with the office. Naveed and the team, they have, you know, Ruthie and Tanya, they've got so many resources to guide you and support you in that. So you don't need to worry about putting a foot wrong there. So yeah, don't hesitate to reach out. Mark your diaries. Looking forward to seeing you all again next month's conference call, Tuesday, the 5th of April. Enjoy the rest of March. So many thanks, everybody. And thank you again, Yuvi.